Hello, and my name is Autumn Johnston, and for my paper today, I did a paper about why there's a shortages of nurses in the United States. I did this because nurses are really the backbone of hospitals, and it really just got me thinking because this is what the profession that I wanted to do. But I heard a lot of stories from my uncle, who is a lead nurse at the local hospital. He told me a lot of stories of what goes on as a nurse and what they have to deal with, and it just wasn't for me. But without nurses, we wouldn't be able to do literally anything in the hospital. Like, they do the most out of, I think, everyone at the hospital. They do a lot for us. And I wanted to just go into detail of like what the things that they do and what they have to deal with and why they decided to like why there is a shortage because of the things that they do have to deal with. So my abstract that I did was just something about like talking about the paper, which was basically talking about how they know that they're understaffed, that they work long hours because of this understaffing, that they go above and beyond of their intended roles, and that because of this they experience a severe burnout that is basically what makes them not want to stay with what they're doing. And they take on multiple responsibilities and multiple like tasks throughout the day. It also goes into detail about the emotional and physical toll that they go through, especially during the pandemic. I really want to focus kind of on that because it was such a hard time that nurses were watching a lot of people that they probably knew and loved go to the hospital and have bad things happen to them, and then on top of that they were having coworkers get COVID and having to watch them get sick and end up dying as well. It's horrible. I also went into detail of how we can identify these problems of everything that's happening to these nurses and how we can really get down into it and know what is the cause of everything. I also went into how strong leadership can affect nurses and how with that strong leadership they can go above and beyond and really want to do what they want to do, and that it will promote better communication, teamwork, and overall just make their job better. I also wanted to go into the importance of recognizing the nurses and what they do and know that like they are undermined, they are underthanked, they're literally like when you think of the hospital, I think of nurses. We don't know what they do, and it's just nice to just make sure that they get that appreciation and that they know that like, hey, we should do something about this issue. So that was what my abstract was about, and then I went into doing my introduction, which is basically saying that our healthcare is facing this national crisis of the shortage of nurses, especially during the pandemic, which did not create this problem, as it's been a problem way before that, but it really showed what kind of went on with it. Like, what I mean is like how the shortage really did affect everyone and how they were really severely underprepared to do everything, and how essential the nurses are to patient care and making sure that they are taking their medication, getting their blood drawn, having the different exams drawn for them. I also went into detail on the introduction by saying that the demands of their job keep increasing. Like, they don't decrease, they don't do anything, they keep increasing as time goes on, and that it is really hard for nurses to find that balance of keeping everything keeping from burning out because they have such a big workload that they're working like 12-hour shifts. I was like, that's their normal shift, is a 12-hour shift. They can work past that because of how much work that they have to do because they don't have enough nurses, and that increases burnout across professions. And then on top of that burnout, you have to deal with the rude patients that come in and just want to take up all your time and give nothing to you. They give no thanks, no nothing, because they only think about the doctors. They don't think about the nurses who actually go through and make sure everything's okay with you before the doctors even see it. And then I also went into detail on the inclusion about saying that with nursing, you have to look beyond just the staffing numbers. You have to look at their emotional attachment to the job. How much are they putting into it? How much they want feedback from their patients, or how much they want to do it. Because at a certain time, you do go into this profession thinking, this is what I want to do, this is what I signed up for, and then as time goes on, it's nothing that what you signed up for. It's nothing from what the stories they tell you. You deal with a lot of stuff, and that stuff can cause a lot of people to quit because it's not what they thought they signed up for. They signed up for something that was taking care of people, not doing the dirty work of the hospital and doing literally everything in the hospital. And it can get rough. It can get really rough because once you make that realization, it makes you not want to do your job anymore, and it makes you very, not mad at yourself, but mad that you chose this profession and spent a lot of time and money to do it. So for my first body paragraph, I went into the role of like, they begin this with a dream of becoming a nurse and to caring for the sick and injured, but it's not really what they think that is. It's mostly that they do a level of distress now because they have to do so much. They have to take care of so much that most of them left with a burnout because of doing so much stuff for the patients because they don't have enough help. They never have enough help because the hospitals budget them and they think they're spending too much time and too much money on nurses when there should be more nurses, when there should be a lot more people working there. And not having the amount of support and having the demand of the workload just adds to their stress, and it makes longer hours, longer days, and it's just difficult because then you can't recover from the days that you were working. And then how they also use that passion against them, saying like it's a calling, a labor for love, and that they should love what they're doing so they don't pay them as much because they should love their job more than what they should get paying. But it's not exactly true. You still need to get paid for what you're doing. And it is nice to have a nice paycheck at the end of the day. It really is. Because as much as you love what you're doing, you have to be able to support yourself with that. And that's not happening for these nurses. The second body paragraph is about how they have the most stressful job there. I would say it's more stressful than doctors, not maybe as much as surgeons since they're putting the lives on the line, but nurses do have to deal with the snarkiness of the patients, having someone's life in your hands, going through the vital signs, and it just makes everything so much harder. And it makes them put a stressor, like a really big stressor, on the welfare of the nurse's life. And that having this stressful job makes life very hard, where if you go to work unhappy, you're going to be unhappy the rest of the day. And you won't really be having a good day, which means it affects other people, your coworkers. That means they're going to have a bad day, which then inflicts on the patients. So they're going to realize that you don't want, or the nurse doesn't want to be there. Why are they helping them? Why don't they get somebody else to help them? and go with their care if they just don't want to be there. No one wants a nurse that isn't happy to be doing their job. And in this paragraph, I stated that nurses' job satisfaction improves the patient morale, and it improves their satisfaction. That if they're more likely to be satisfied with their job, it makes the healthcare experience so much better, because then they are happy. Happy nurses, happy patients, it makes everything better. In the third body paragraph, I went into how experiencing, especially in COVID-19, experiencing these losses and experiencing putting the care of people's lives in your hands can really affect a person's mental health and can make them very overwhelmed and very emotionally draining. As if you do lose a patient, you have the nurse has to deal with that and keep working. They can't take the time to just sit there and decompress. They have a job to do. They have to go out and they have to go and continue working, because that's what they're there for. They have to save other people. And it was really hard during the pandemic, because not only was it just a lot of people that were dying, but it was coworkers, it was families, it was friends. And that really put a strain on them, because they can't take the time off to just go over and decompress after losing a family or friend. They don't have that time, because people are counting on them and saving other people's lives. So when COVID-19 ended, a lot of nurses left, because they couldn't deal with that emotional strain of not decompressing when they could, and they saw the worst of everything. They saw the worst of everything and everyone, and they had to just leave. They retired, or they quit, or they found a different position. They just couldn't do that, and that was something that was really frightening, because they were already in a shortage, and now that nurses were leaving, it didn't help anymore. And with that solution, with that problem, it didn't help anything. And then in the fourth body paragraph, I talked about how with that happening, they had no support to back them up. They had nothing to help them. They had to just rely on the people that they had and wait for help, like the administrators or management, to send them people to make it a little bit easier on them. But they never got that, so they had to do with what they had to do. And it goes into detail on like how we can improve this situation by implementing technology. If you have the right technology, it makes the job a little bit easier, and you don't need as many nurses if you have technology there to help you. With the technology, it allows the nurses to have less of a burden, as they don't have to keep checking in on the patient and doing blood pressure or doing their temperature, when they have something that's there to tell them everything and to alert them if something bad did happen. So it was just, in that article, and in my body paragraph, I stated the article saying that it was just so much better to have technology, or to have the technology to do that. It also said that if you empowered them with the tools and the resources to better their education, that way they can help patients better, that you should support them into doing that. Because if you support your nurses, they will feel better morale-wise, like happier to be there. And then if you do these programs, such as the tools and stuff, it will turn into better patient outcomes and better nurses, and nurses that want to be there, and healthcare management seeing that and seeing like, yeah, we can do this with more people like you that are cross-trained everywhere, and it will just be better overall. My fifth body paragraph went into how nurses really deal with the shortages and how they work around them, kind of. and how leadership really makes a big impact on that. Because if you have a good leader that shows you what to do, that shows you, yeah, I'm here with you and I'm here to support you, it makes life a lot better. Talking from personal experience, when I had a great leader, I was happy to go to work even though the conditions were horrible. But I was happy to go to work to see what I could do. I was happy to go there, have a good time, and I was working harder. And that's what's going to happen with these nurses if leadership supports them and shows them, hey, I am here for you. What do you need? They will want to go to work. They will work harder, work faster, do things a lot better, and it will just be overall a greater experience in the healthcare industry for nurses and for patients. And then I went into conclusion about how this is a serious issue that should be considered and that it's going to be ongoing if we don't do something. That nurses do, in fact, have overwhelming workloads. They have burnout and lack of support. But once we fix this, nurses will be so much better. It would be so much better to work with, to be there. Nurses will actually want to come. There will be less shortage. Once they get all of this done and ready, nurses will want to come back. They would want to stop trying to look for other professions because there isn't enough of them. It would just overall make it a lot better than what it is today if they do all of these and they follow the guideline, not the guidelines, but they follow a way that can make it better. That nurses are the backbone of healthcare, and that without them, we can't do anything to help save people, and that it's vital that if they succeed, we also succeed in the healthcare industry. And then I did my works cited page, and that was basically a big summary of my paper. Thank you for listening.